Hi guys, welcome back to RTs Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everybody. Welcome to anyone new and exciting because we are still in Women's History Month and I have some amazing guest co-hosts. And I'm doing something a little different. I have 4 guest co-hosts with me here today. How many fingers did I put up? 4. 4 guest co-hosts with me today. So before I let them do their thing, I always usually read the accolades. But for me to read everyone's accolades here today, we'll be here for 3 months. So, because they've done so much. But today, we're joined by an extraordinary team, WHEEZER. Okay, so a group of dedicated respiratory therapists who embody warmth, empathy, and resilience in their work. Individually, they bring diverse expertise and a shared passion for helping others breathe easier. Please welcome our esteemed co-hosts as they share their insights and stories in our discussion on women supporting one another in the respiratory care field. Hi, ladies. Yes, girl power. Okay, so what I'm going to do is I'm going to let everyone individually introduce themselves, their expertise, and how many years they've been doing this. And we're going to move forward with the show. So we can start with Flo. You want to go first?
I can, because I'm the newest to the bunch. I'm the newest to the career. My name is Flo Lockett Miles, and I am the newest RRT AEC in the bunch. I am an educator as well, and I have the distinct pleasure of still working bedside and recruiting for respiratory therapists, not just to come into the school, but to branch out and just show what the industry and the career can do nationwide. And it has been my pleasure to been doing so for just a few years, but yeah, I'm in it to win it.
Yes, Flo. Glad to have you, Flo. Amen.
Glad to be a part.
And Flo is hilarious, by the way. But yeah, we'll talk about that. Who else I got? Who want to go next? Robin, I
We
see
got
you.
Cece.
Ooh, Cece. Oh,
Hey,
Cece, go ahead.
hi, my name is Cece Olmixon. I'm the program director for the Victoria College Respiratory Care Program. I've been a therapist for, we'll just say 3+ decades and leave it at that. I am a big proponent of shared networking and resources and stuff. Our profession is amazing. I have met amazing people along the way. As an educator, I love helping get that next generation out there and ready to enter the profession. And I just love watching that passion ignite in people who, they say respiratory is the best hidden treasure. So I love being able to unveil it and then let them grab hold of that torch and run with it.
Yeah, Cece. Happy to have you here today. Who's next? Who I have? Robin, I see you next, actually.
Sure. Hey, everybody. It's great to be on. My name is Robin Garcia. I'm actually a manager for respiratory in Abilene, Texas, and I've been in the business since 1996. So I've had a pretty kind of different kind of journey than most because I went back to school later to get my degree. Went to Midwestern and graduated in 2019, and then went back to Texas State, and I graduated there from 2021. And so I feel like I bring a different kind of perspective about getting your career in respiratory, and I'm all about helping people achieve the best they can. So leadership has been a different journey for me. I've been in leadership for about 7 years, but I actually became a manager this past September. So
nice. Congratulations. Okay. Glad to have you, Robin. All right, Karen. Well, that leaves you.
Hi, I'm Karen Gregory. Thank you so much for inviting our Team WHEEZER. We're tough and we're strong and we're just so united and so grateful. I'm a respiratory therapist, and then I also work as an advanced practice provider and a certified asthma educator. I kind of blended my roles together, and I love it. The foundation of my career is respiratory therapy. I love the lungs. I teach at a nurse practitioner program too, and I tell my students I live north of the belly button, so that's just that's my home is the lungs. And I love so much getting to I echo what Cece says, getting to watch this next generation pass the torch, but it's hard to let go of that torch. I think we hold on to it and just let them grab down here. But thank you so much for listening.
Yes, Karen, love to have you once again. So, you know, I tell everybody you're hilarious and smart and all that good stuff. So I just love having you here with us today. So yes, Team WHEEZER. So well, I guess I should say who I am for those who don't know me. I'm Belinda. Folks call me the Asthma Lady. So I'm the host of this show, the RTs Share Tea Podcast. And I had the opportunity to work with these wonderful ladies not too long ago on an initiative around asthma, providing asthma education and asthma education workshop to other healthcare professionals in Texas. So we were known as Team WHEEZER. So I was always excited to get them all back together again to do something and just sharing positive vibes. So, and Cece was I call us the Avengers of the lungs, I guess.
Asthma Avengers.
Of asthma. And Cece was the Nick Fury. She was the one who got us all together. She activated Team WHEEZER, and we were able to push through that initiative, that workshop not too long ago. So once again, ladies, thank you so much for being here with us during Women's History Month. Such a important month, I think, for us now. Okay, so with that being said, us introducing ourselves and having all these different perspectives because we're in different areas and phases in our careers. Mm-hmm. So can anyone share any triumphs or, challenges that they face within the careers where the importance of support coming from other coworkers or other women that you work with came in and played a role?
Well, I'll start because I've been at it a little bit longer. And so I've had lots of opportunities where, especially early on, just trying to navigate at the bedside. And then when I decided to further my degree, this was before we had bachelor's programs in our discipline and stuff. Okay. It was interesting. I actually worked with someone who she was always a proponent of you got to get more education. You got to get more education. And I'm like, why? I do the same thing every day. I mean, it's different patients, but and she's like, no, you just don't understand. It's just so important. And I was like, oh, okay, sure. Our family grew up on education was really important. So it wasn't a really hard leap. But at the time I couldn't see where it was really going to serve me well, but it really did. And with her pushing me and the people I worked with, I don't do anything by myself. We're all on our own walks, but we all have our little circle of influence and our network of support that takes us through every day. And like, there were days, because if we're going to do it, let's just get it done and get it done as quick as possible. So, you work full time and you go to classes full time and, there's that edge of, why am I doing this? But, because I brought all of my people on board, it was like, okay, on the days when I'm struggling, y'all are going to have to kick me a little bit, get me going, keep me going. And so I think it's just really crucial that we always have a network of influence and a set of resources that can help us on our daily struggle. Because some days are easier than others. Right. But the reality is none of us walk this walk alone. And so it's really important to have people that know what you're trying to do and that support you in So I think it's
I
amazing.
love it. Yeah, Cece. That's good. Anyone else?
I love it when we started Team WHEEZERS. We were just, I mean, I think it was the first time, and Linda, you were our great, Cece, you got us together, and Linda, you were a great leader. But I loved how one of the simple things, something so simple, it took all this, we were going to play a game for after each discipline, after each thing to empower, to make it more active. I couldn't think of a game. I couldn't do any, I was thinking like, go to the library and all this. These women helped me and did it. I mean, I know both, Flo and Robin, you guys
Robin.
got me on my track and taught me so much, and then even taught me how to navigate through, make it fun. So when I got up to be my turn, it looked like I was just I did all this, but I could not have done it. It was Family Feud, questions on asthma with Family Feud, and I just appreciated that so much because I wanted to be so good at it, and I couldn't have done it without you four ladies.
Oh, we had buzzards and we had Family
Yes.
Feud music and
I wouldn't have thought
prizes.
of buzzards. I would have thought, raise your hand.
Right. And Robin came with cahoots. I didn't even know
Yeah.
about cahoots
I love
Yes.
before
A
she mentioned
game,
that. So
yes.
that was a good one too for the workshop.
And I
Yeah.
just loved how you all embraced me and we got through, because I was weak at that, and you picked me up and carried me through, and it made it look like I was just right along with you.
Yeah, you did good. You did good. And I for with Karen saying that, it reminds me of something that I had with Flo. I'm new into the academia world. So I'm a new part-time adjunct. And and I was doing the didactic teaching. I wanted to pull every hair off my body slowly with tweezers.
I know.
Because I just could not, and I just, so Flo started to just text me a little bit to kind of check in. And I really appreciated that. And Flo has been giving me just little nuggets, and it helped me a lot, Flo. And I don't think I ever told you that recently, but it really did help me because I'm still trying to figure it out. So I'm doing lab work now, so which is a little different, but
Okay.
those were challenging days. The first couple of weeks were challenging. So
Yeah,
yeah.
there was some long text threads. It was
Right.
okay. Yeah, it was all right.
Right. So I appreciate that.
If I can chime in, if I may,
Oh,
for me, I already had like a master's degree and other degrees, and I went into respiratory really late, like after that. And I had a lady in class one day, and she said, I don't know, I was just doing RT. I was like, I think I'm gonna do this. And she was in a different discipline, but healthcare. And she said, yeah, you go get this license. And she goes, and it's going to change your life. She said it just like that. She goes, you've got that other stuff. Go do this. And ever since then, I meet women like y'all, right? I go to these conferences and I get hooked up
yes.
with these women who have these thoughts, and you're not crabs in a barrel, right? You're like, oh,
Yes.
let me get you where you want to go. Let me
Yes.
help you get to where you want. Let me show you this. And there's room, like there's room for all of us, whether we want to participate in it or just learn from it or help somebody excel in it. Like there's room for us. And that is a comfortable space because it's not even just mentorship, it's sponsorship. Right? So I'm not just showing you, but if you want to participate, you got to get here, and let me show you how to get
How to
to
do.
here.
Yes.
I love that.
Right? And I have the choice to say, I don't think I can do that. Yes, I can do that. No, I don't want to do that without hurting anybody. Right? I can text Robin right now and be like, I don't know what this is. I need you, girl. Right? And there's no, and it was just, and that we've only known each other a year.
Right.
Yeah.
A year, and just
Doesn't feel
from
like it.
it doesn't
It don't feel like
doesn't
it.
feel
I
like
feel
that.
like I've known Robin for years. Flo, Cece, the Nick Fury, Karen.
Yeah. And like when you got Dr. Millard,
Huh.
right? Okay,
Yeah.
you get Dr. Millard. To this day, I saw him at Baylor, and you should see my student's face like, you know him? I was like, oh yeah. Like,
Oh, that
we
is.
walk the red carpet every day, But it took, it's that kind of interaction where again, it was not just mentorship, and it's just that love of let's get this RT industry and the
Yes.
women in this industry, let's give them that nudge, that lift, that muscle, that
Yes.
pressure, whatever, to
Mhm.
get you up there where you want to go without judgment. I mean, it's a
Yeah.
very healthy space.
Yes.
It's a very healthy space.
Yes, 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 yes. So I just feel like we definitely have been supporting each other, just allowing each other to shine in the light that we're supposed to be shining. And it's not no one has to dim what they're doing. I don't know how to say it, but we just like
We
hearing
all
about each
celebrated
other.
together.
And right. It's just like just being supportive and just allowing each other to be who we all are in our respective space. So I really
Mhm.
do love that with working with you ladies and anything that we work on, whether it's in the virtual space like now, or together face to face or anything like that. So kudos. So we basically already starting to talk about this, like career advancements in respiratory, things like we already mentioned networking and furthering education and mentorship. So what I guess we could, like we said, we started talking about this already. So what do you guys feel is of value to progressing in the field, especially as women?
If I can jump in here, I think you need to keep learning. It
Ah,
doesn't even always take money or anything like that. Just keep learning, even from each other,
mhm.
like reaching out to people. But I mean, if you can further your education, some of the biggest networking for me was when I actually did go back to college. But I mean, going to conventions,
Mhm.
just
Yes.
celebrating the profession. You meet so many great people. Obviously, I met all of y'all. You're amazing in my life. And so I think just getting out there and getting out of your comfort zone, I think networking happens naturally if you do those
Yeah,
things.
Right.
that's a very good point.
Yes, yes, yes. I've spoke about this before. Networking was not really my thing in the beginning because I was such into, like, I like to help people, but I'm an introvert. So it's like
Right.
I never really was like the office mingle person. I was the go to work. Like I work, okay, this is what I'm doing, and then I go home. Work, go home. So I didn't really go to like the Christmas parties or any of that stuff.
Okay.
So, but I had to learn the value of networking, like especially when you have to push initiatives and when you have things that are missions that are bigger than you, and because
Yeah.
you cannot do that work alone. And we said that.
No.
And I,
No.
I I had to learn to do better at that. And this is how I got to where I am now. I'm grateful because I got to meet you guys. So, going to the conferences and just meeting, expanding the network and just nurturing these relationships, right?
Mhm. Oh, I love that. Nurturing.
Yeah.
I like this saying, it's a makeup that I buy, but it's a woman-owned company. Thrive, I know I'm not endorsing anything, but I got this bag from it, says empowered women empower women. And I
Mhm.
think that is where I would like to see us as respiratory therapists go, I mean, guys can join us, but but for some, but not
There's a
just
fee.
for a fee.
I
But
love that.
I
I
mean,
love
that's what kind of wish I could see our Team WHEEZER's doing too, is empowering others and people empowering us and us empowering others.
Yes, I
Yeah.
love that empowerment. So you guys said some key things. So we mentioned networking, going, putting in the time to continue learning. We said sponsorship, putting your name out there.
Mhm.
Like if a door opened for you, allowing someone, bringing someone else through the door. Amazing, mentorship, just showing giving the how and helping other people. So we said a few things and just being a support, maybe just being the ear. Hey, listen, texting, how you doing? And how did this go? So yeah, we said a few things. This is great. And I have a question for you guys, and this is a real question
Okay.
that was DM'd to me from somebody. Hold on, I'm just trying to pull up the question. I don't have my glasses, guys. Sorry. It's taking me a little time to see things. That I'm getting older, guys. I'm sorry. All right. So, okay. So this is from an actual respiratory therapist who is
Okay.
new to the field. So she has been in the field, is a woman, and she's been in the field for 1 year. And so she reached out for some advice. Okay, so currently I work as a respiratory therapist. I'm very new into the field, but I want to have an impact in the respiratory care field. So I'm very touched that she reached out to me for that. So I wanted to know if you can advise me on different areas where I can grow in the respiratory field. So due to the fact that I'm still trying to figure out and plan on furthering my education. So right now, what I do know is she's a CRT. So CRT.
Okay.
So that's what I know. So far she's worked for 1 year. She's a CRT and her main area is in acute care. So she's done ICU.
Okay.
And I believe adult care is her main. So what do you guys, so what do we think?
I know Robin's thinking this because I can, Robin here, chime in, girl. Okay, here we go. That CRT, we need that RRT. All right, we need that RRT. Let's just cut to the chase. Okay. Let's do that because she's got experience and she's new to the game. She's got time to grow. So
Yeah.
I don't want her to feel like I have to do this tomorrow, right?
Yes.
But she needs tomorrow that RRT. So if I had to say anything to her as an educator to a student or a new grad, my push would be get that RRT.
Absolutely.
That would be my first. I wouldn't even mentor. After that, the doors are going to open.
Yes.
But that's the stifle. And come on by.
Flo is like on my wavelength. The RRT opens up, it just opens up so many doors to not just different tests you can take later, but even taking the test, it opens doors where there's different things out there like PFTs and you start learning about asthma more, the AEC, the ACCS, and then it'll open doors that maybe she could mentor or go check out if her area has a pulmonary rehab or something where she can open and expand. But yeah, you really, really need to go after the RRT.
Or RT case management or recruitment. Like,
yes,
you need that credential for people to take you just a little bit. We're women. We know better. We need that extra credential. But if she's going to pull people into the fold, they need to know that she got that skill that she has a little bit of a title behind it, and they can trust her with that.
Right.
And then she can go where she needs to go. But that RRT is going to be that's it. I'm sorry.
Absolutely. I agree.
She needs to commit to herself that she wants to get that entry level certification credential, because that's a really critical piece. Because like everybody said, the diversity and the breadth of avenues that you have once you have that registry credential is just amazing. There's no other way to say it. So if you really want to have this rich, amazing career in this profession with all of these opportunities, that registry credential is where it starts. So she
And
needs
that's a
to commit
small
to
piece. She
herself.
can do it.
She needs to commit to herself to get that, and however she needs to do it. And if she is fearful of it, then she just needs to hook up with any kind of educators or anybody that can help support her in that element. And there's tons of resources out there, but she needs to commit to herself to get that registry, because then, like these ladies said, all the doors open. There's just a massive amounts of opportunities as respiratory therapists.
And there's so many review courses. I know I had to attend a weekend review course, or I wouldn't. But there's so, I agree. There's so much, and AARC helps too.
Resources. Yes.
All the AARC stuff. Yeah.
I appreciate you, ladies. We're going to wrap it up, but I love this. I love this energy, and I couldn't have done this any better. I think on my
It's Team
own. I
WHEEZER.
really appreciate
Team
the
WHEEZER.
women power energy. I really needed this, especially this week. I'm exhausted actually from everything I've been doing, but doing things like this definitely gives me the energy to continue. And yeah, I appreciate you guys sharing your perspectives and just showing in real time how to support one another. That I mean, I don't think people sometimes they have a hard time seeing these things and they don't think it exists, but it does. And you know, that's what I wanted to do during Women's History Month. So that was the objective for this. So yeah, guys, thank you so much for being here.
Thank you, Linda.
Thank you.
I appreciate you guys so much. Know that RTs Share Tea Podcast is on most podcast platforms on Wednesdays, and we are on YouTube on Thursdays. Thank you so much, guys, for listening. So much more to come. And remember, guys, to invest in yourself and to only compete with yesterday's version of you. I will see you next week. Bye. Thank you, ladies.